Highland is a massive geographical landmass. In Sutherland alone, we've got 2,000 square miles that we cover. And for many parts of Highland, we have challenges around the fact that most of our communities are on the periphery, so around the coastal areas and not necessarily in the sort of the central areas. So that's a particular problem in Sutherland. We've only got 1 or 2 towns and villages in the centre. Most of them are absolutely scattered throughout the whole of the county. So that is the biggest challenge for us, is actually how do we provide those health services and those social care services over such a vast geography. And what we've also got is that it's small numbers of people in those areas too. And one of the things that's so hugely beneficial is that we've got the health and wellbeing hubs here in Sutherland and in some areas as well around Highland, and we're looking at that further as to how we can adapt that with compassionate communities, for instance. And what they do is they provide valuable links for the whole communities in those areas.
NHS Highlands got quite a number of issues in relation to reaching people in rural communities. By their very nature, they can be quite remote in terms of travel. We have issues in terms of recruiting staff in remote and rural areas, and also we have issues in relation to staff that we do have need to be more general or generic in the work that they do, because there just aren't enough specialist staff to go round to the very many small towns and communities across Highland. So the beauty of the screens and their benefit to the NHS is that we will be able to tie in some specialist advice and indeed any health advice to individuals through the Screens project, so that people don't have to travel to a hospital or a clinic to get that advice and support from a health professional. But also health professionals won't need to use their time travelling long distances between different communities and towns, and can spend more of their time actually giving support to individuals and providing a service to communities, which can only benefit both the NHS and individuals and communities across Highland.